Good afternoon to the audience participating with us today through various channels, and welcome to this important session of the Knowledge Summit titled Promoting Science Policy Dialogue, IAP and EASAC work on climate change and health. Before we start, maybe a couple of technical points. Simultaneous interpretation is available into Arabic. So for those following us through social media who would like to get interpretation and receive a certificate, kindly join the session through the link on the video. For attendees through the Knowledge Summit platform, you can get interpretation by hovering on the screen and clicking on the headphones icon and choosing Arabic. All right, so I would like to thank you, NDP, for inviting me to moderate this session. My name is Jana Al Baba. I'm Sustainable Development Officer with the Economic and Social Commission for Western Asia, ESCWA, which is one of the 5 regional commissions of the United Nations Secretariat. I'm really honored to be in that session, which in my opinion tackles really 2 very important issues, not only in the Arab region, but at the global level. So the first is, of course, the impact of climate change on health, which we will learn a lot about today from the work by the Inter-Academy Partnership. But the second also important issue is evaluating and using scientific evidence to inform policy and practice to address these impacts. In fact, the recently issued report of the IPCC, the 6th report, recognizes that knowledge about climate change really has significantly expanded over the past years. But nevertheless, there are knowledge gaps that continue to persist. For example, we know a little bit more on the impact of climate change on ecosystems. We might know also on the impact on human systems, such as food production, infrastructure, etc. But certainly a less studied area, at least in the Arab region, is the impact of climate change on human health, both physical and mental. So we're here to talk about that and how to fill these gaps and how to use this scientific evidence in policy making. In fact, just yesterday we concluded the Arab Forum for Sustainable Development, which is our annual event for reviewing the implementation of the 2030 Agenda and the SDGs. And one of the very striking messages as we were reviewing, for example, the SDG 14 on life below water, is how much marine science is underfunded in the region, but also the difficulties of developing really comprehensive and evidence-based policies for conserving marine resources and protecting the livelihoods that depend on them. So I could see very well the parallelism with the issues we will discuss today and the forum. Who is best placed to talk to us about these issues? We have with us today Dr. Robin Fears, who is the IAP Project Coordinator and EASAC Biosciences Programme Director, who will provide insights on the issue drawing from his recent experience with the IAP and its regional academy networks. For more than 2 decades, Dr. Fears has provided advice on bioscience policy issues to a range of public sector organizations, and we welcome him to this session. So without further ado, I give Dr. Fears the floor, following which we will have an open discussion. Please, Dr. Fears.
Thank you very much, Jana. I'm very pleased to present to you all today, and I thank also the organisers for inviting me. Good evening to you all. I'm Robin Fears, and as you just heard in my slides, I will be covering the work of the Academies of Science worldwide on some of the issues for climate change and health. Can I change my own slides? No? Next slide. Can I change my slides from here? No. I can't seem to get the slides to move. So what I'm covering in the next few minutes will focus on climate change and health, drawing on work from IAP, which I will describe what IAP is, and a current project we have on climate change and health. I will present 4 examples relevant to the Arab region. And as Jana said, I will also use these examples and other information to say a little bit more generally about how the scientific community can provide evidence to policymakers and other stakeholders to inform policy and practice, whether that's at the local and country level, the regional level, or the global level. And I will try and conclude by identifying what one or two things that we think can optimise the science policy dialogue. As I think I'm sure you all know, that the climate is warming worldwide and is projected to continue doing so. The Arab region of the Eastern Mediterranean and Middle East is warming faster than some other regions, as described on this slide, and the projections are that it will continue to do so, to warm even further, unless robust action is taken. So this is a problem. It is the first and foremost the challenge for policymakers in this region and elsewhere. In terms of health outcomes, and this slide takes a global perspective, climate change effects are expressed by a number of different pathways: heat, flooding, extreme weather events, and others. The size and nature of the impacts of those pathways on human health is modified and mediated by a number of variables, such as socioeconomic status, access to healthcare, but broadly, worldwide, but we're all vulnerable to these exposure pathways and the potential health outcomes. But certain population groups are particularly vulnerable, for example, including the poor, the elderly, the young, those with pre-existing illnesses. The types of health impacts that have already been documented and are beginning to be attributed to climate change pathways are multiple. Include most obviously heat-related cardiovascular events, for example, respiratory consequences, asthma and other respiratory diseases, a whole range of infections, waterborne, foodborne, and vector-borne worldwide. Influences, as Jana said in her introduction, via our agriculture on food nutrition security, and others. And there's a significant recognition of the physical effects, health effects. What has not been so well understood until recently is that there are considerable mental health effects also from a number of these exposure pathways. And I will exemplify some of those in my slides. As Jana mentioned, that the work that I am presenting is drawn from academies of science, engineering and medicine worldwide. The inter-academy partnership that's described here comprises more than 140 national academies. And these academies are arranged in 4 regional academy networks. The network in which I sit is EASAC for Europe. Their equivalent networks are Asia, Africa, and the Americas. And in fact, when one looks at the extended Mediterranean, North Africa, Middle East region, that region overlaps with our Asian, African, and European networks. So there is considerable interest throughout the IAP family in the issues for this region. A couple of years ago, IAP started a new global project funded by the German government on climate change and health, essentially to examine the evidence that was available in the 4 regions, to share that evidence for impacts on health and predictions of future impacts on health, and in particular, to focus on identifying how science can help in identifying and implementing solutions to those climate effects on health. During the period that's elapsed since the project started, the 4 regional groupings I showed you in the previous slide have produced regional reports. 3 of those are now published, and the 4th in Africa will be published next month. These regional reports are used by our academies in the region, both at the national and regional level, to engage with policymakers and other stakeholders to explain and advise how scientific evidence can be used to inform decision-making, particularly for solutions. In addition, each of those 4 regional reports is providing a resource for a 5th global report that will be published in May of this year, which will draw on the diversity of the evidence to evaluate similarities and differences within and between regions, provide advice to decision makers at all levels, and particularly focus on those issues that can only be addressed at the global level. In terms of global public goods, and science is a global public good, or where the level of effort required is beyond the capacity of a single country or region. And I'll come back to that in a minute. Our working groups have wide geographical distribution in Africa, Asia, Pacific, Americas, and Europe. And as I say, their regional reports are now published or will be next month, and they're available on our Academy websites or the IAP website. I might just mention that if you look at the countries listed here, that there are relatively few in the Arab area. This was a defect in some regards in our ability to collect and think about the evidence in these regional working groups. And we addressed that problem by initiating a specific piece of work for the Mediterranean and Arab area that I will come to in a few slides' time. So I think all in all, we have a reasonable geographical spread. And other countries, of course, were involved in peer reviewing the reports or endorsing the reports on behalf of their national academies. So these were the countries in the working groups, but we had wider representation than that. And actually, I want to emphasize that the European work started rather earlier than the other regions for various historical reasons, particular one being a legacy of interest by European academies in some of these issues. We published the European arm a year and a half ago now, and this report is freely available, and I won't spend time going into the detail, but essentially we focused on how to link science with policy, particularly policy for solutions in terms of adaptation and mitigation to climate change, and I'll describe what I mean by that in a minute. Also using research to communicate about the issues for impact and for solutions to the wider public, and as part of that communication to counter sometimes deliberately false information, misinformation that's been circulated by vested interests in some areas. We emphasise that very much, that the evidence is available for us to act now, and we should use that evidence to pursue health in all policies, not just the health sector, but all sectors are relevant to health policy. And in addition to using the evidence already available, the scientific community, of course, has a responsibility to fill evidence gaps by new research. And I'll come to some of those gaps for vulnerable groups or for documenting solutions. And finally, as I mentioned, there was a specific use of this European report to nucleate and catalyse the global project. And it was important to emphasise that because, of course, the 4 regional activities needed to start from a similar starting point. Otherwise, it would be difficult to map their conclusions and draw information from the evidence that they were providing. So our regional activities were preceded by a global discussion of the scientists to identify where there was a consensus on what were the main effects of climate change on health now and in the future. What are the solutions that we can conceive? Where are the gaps in the evidence? Who are the vulnerable groups, and how can we focus on them in our work? How can we link the different levels between the local, national, regional and global implications? And indeed, as Jana said previously, how do we link specific recommendations about climate and health with, for example, the broader framework provided by the Sustainable Development Goals? So we were mindful of all of these criteria for our starting point. And I just emphasize here that the focus on solutions, mitigation and adaptation, that is mitigation is action to reduce greenhouse gas emissions, for example, from fossil fuel combustion, biomass combustion, agriculture, reduce greenhouse gases and thereby reduce climate change. Mitigation can also bring local and direct and near-term benefits to health. And I would describe a couple of examples in addition to the benefits to health that come from reducing global warming. In addition to mitigation, solutions can be identified that adapt to the risks of climate change impacts that cannot be reduced by mitigation. Point I want, and there's some examples on this slide, but there are many other ways of exemplifying mitigation and adaptation. I'll mention a couple in future slides. What is important is that we take an integrated view of mitigation and adaptation solutions. In the past, the scientific community for mitigation and for adaptation have often acted in a rather silo fashion without appropriate engagement between different approaches. And that must change in order to build climate resilience. One other point that I want to emphasize, that during the course of this Academies project, we had expert working groups, as you saw, but we were also very keen to involve the wider scientific community and indeed other stakeholders in our activities to collect evidence and generate recommendations. So throughout the last 2 years, we have been engaging in various ways, more broadly with the science community and with various UN bodies and others to explain what we wanted to do, where our focus was, and to solicit feedback on the value of doing that and on the value of how we were proceeding. This is a paper we published in the journal PLOS Medicine last year. We've been very active in a number of international and regional events, for example, COP26 last year in the UK, in presenting to the community to seek further feedback on our emerging conclusions. Now, let me turn now to some examples. There's a lot of detail behind these examples, so I refer you to our regional and global reports over the next couple of months. The first example is food systems and agriculture. As Jana mentioned, one of the effects of climate change is on reducing agricultural productivity in many regions of the world, including the Arab region, because of high temperatures, changes in precipitation, increases in pests and diseases of crops, and other factors, including reduced ability to work outside in very high temperatures. So there's a whole range of relevant drivers for the decline in productivity. But this slide shows some projections for mid-century, but we are already seeing declining productivity of food crops in a number of countries, both with regard to declining cereal yields in this region and in Europe, for example, and declining yields of fruit and vegetables. And so that's clearly an issue altogether for calories and for nutrition, particularly of populations that may already be vulnerable to malnutrition. So there are significant increasing likelihood of problems to food systems, particularly problems to agriculture from climate change. At the same time, agriculture itself contributes to climate change. Agriculture worldwide contributes about 30% of total greenhouse gas emissions. That varies, of course, according to region, and it's seen in this region that this includes both agriculture practices and land use changes for agriculture. Again, if nothing is done, that contribution to greenhouse gas emissions is expected to increase this century. So in policy terms, the objective is twinfold, to combine the adaptation to improve climate resilient agriculture that can respond to a changing climate, while at the same time, mitigation that is reducing agriculture's contribution to the emissions of the greenhouse gases. And we have the scientific evidence and know how to do that, for example, to reduce agriculture's contribution to methane and carbon dioxide and so on, by reducing waste, but by improving agronomic practices in a variety of ways, and by changing diets. And I want to focus on that last point, because changing diets, that is reducing the amount of meat and dairy in those populations where it is excessive. And that's an important caveat. Reducing that meat consumption to the extent that it reduces livestock farming, and it's the livestock that are major contributors to methane, will reduce greenhouse gases significantly. And at the same time, will bring benefits in terms of reduced obesity, diabetes, and other non-communicable diseases. That there's a growing literature on the potential benefits of different ways of changing diets. Mostly that there's agreement that there is a need for replacing meat, particularly red meat, by more plant-based foods. But it's important to emphasize that can only be done while protecting vulnerable groups around the world. That there are many vulnerable groups who already suffer from reduced inadequate nutrient composition of the diet, low iron, for example, some of the vitamins, and they need to be protected from any more general recommendations on changing diet. So that's an important issue for equity. Adaptation opportunities, again, science shows how to contribute in a range of ways, for example, to develop plant breeding approaches with improved plant traits, more resistant to heat or drought or pest diseases. But it's not just biosciences research, but we also need to fill the gaps in social sciences research to understand better the behaviour of food producers, including farmers, and the consumers. If we're seeking to inform changing diets, we need to understand from social science research how to inform that behavioural change. A lot of this work from the Academies in this project what was used to discuss with policymakers last year in the major initiative of the UN Food Systems Summit. And that was a great opportunity to develop a new science policy interface that, of course, is continuing this year. My next two examples come specifically from the work that I mentioned, where we focused on the Arab region and the extended Mediterranean and North Africa. An initiative led by the government of Cyprus is described here, with wide representation from the region shown in the bottom of this slide. And as part of this Cyprus government initiative, we in the Academies organised a workshop with colleagues in the Institute, where we brought in several other countries from an extended region to explore issues widely for health and climate change. The report from this, which is shown on your slide, was published last year. And again, you can access that via the EASAC or the IAP websites. And a couple of examples from that, as I'm sure all of us are aware, one of the priorities of this region is tackling water stress. And countries in this region are amongst those countries worldwide suffering greatly from water stress. These are data from the World Bank. I should just qualify that this is total water stress. It's not so clear what is the proportion of that attributable to climate change and how that will change in the future. But the evidence suggests there is a significant contribution, and that can only worsen in the future under a warming environment. This water stress, has multiple implications for human health in terms of waterborne diseases, vector-borne diseases, for example, agricultural productivity and food insecurity, and mental health effects associated with anxiety at water intakes. The solution really, in this slide, I take from the work of the WMO, who last year advised an integrated approach to the management of water resources. For example, in many countries and regions, we need better early warning systems for drought. We need to fill the gaps in monitoring of data in order to develop better climate services in the region and in countries. We need to improve interaction among various stakeholders, including, of course, the scientific community. And science has a vital role to play in these integrated objectives across the sectors. Again, it's not just the health sector. Other sectors are involved in the problems for health arising from water scarcity. Our colleagues in the Cyprus Institute are using these messages to engage with policymakers around the Arab region now, and further engagement is expected during the course of this year. My second example from this region is migration, that is forced displacement. These are data from the UN High Commission for Refugees. Again, there's some debate about the extent to which the proportion of forced displacement is attributable to climate change. Certain controversy depending on the particular example, but there is evidence that both international displacement and migration within countries can be attributed, at least part, to climate change effects, mediated again by problems with agriculture or drought and so on. Also, of course, in this region, that there are several countries highlighted here who are very much affected because they are the hosts of the migrants, and clearly there are implications for their health and other systems, as well as for the migrants' health. And that really leads to the objectives in policy to how to tackle particular problems for migration induced by climate change or other reasons. A range of health effects have been identified by our Cyprus Institute colleagues in the Mediterranean area. Obviously, direct injury and trauma during the process of displacement, infectious diseases at the destination, non-communicable diseases, sexual and reproductive health, and indeed very much mental health issues. And the way forward in terms of policy objectives, I think, is again twofold. One is to act in the country of origin, for example, to support sustainable food systems and reduce the pressures for forced displacement. And secondly, of course, action in the host country to further develop both climate resilient and migrant inclusive health systems. It's easier said than done, of course, that the scientific community, again, has a role in helping policymakers identify and implement their priorities. And perhaps in one particular regard, scientific community can help and the health community can help, but by explaining to host communities that migrants do not pose a health threat to them in the host community. The evidence base is fairly robust at that point. And my final example, which returns to worldwide, is COVID-19. In many respects, COVID-19 and climate change can be regarded as converging health crises. They both have significant pressures on the health sector, but both suffered from insufficient preparedness in many countries. Both are and will have very high health and economic impacts, borne most severely by vulnerable groups. The effects of one can compound the effects of the other. So, for example, climate change-induced flooding has impaired the response to COVID-19, some countries, and effects of COVID-19 to reduce food security may increase the vulnerability of certain groups to COVID and to malnutrition. Also, we know from the accumulating scientific evidence, air pollution in all of our countries increases respiratory and cardiovascular disease, and the presence of respiratory and cardiovascular disease in turn exacerbates COVID-19. I want to make 2 points in terms of the science policy implications. First, I think we can apply lessons from the response to COVID-19 in the future to the tackling of climate change. Lessons, I think, we've all learned of the importance of rapid mobilization of health resources, focusing on the most vulnerable, using science to inform policy and practice. So some of these have been relative success stories in response to COVID-19, and we do need to apply evidence-based approaches to climate change. And secondly, many countries are currently developing economic recovery plans for the post-COVID phase, fiscal stimuli of various sorts. And this recovery must be sustainable. That is, it must include the objectives for health, equity, and environmental sustainability, as well, of course, as for economic recovery. Now, many governments actually promised a green recovery of that sort in their fiscal stimulus packages. But over the last year, it now appears that many of these promises are not really being kept. And my point is that the scientific community here has again a continuing role to put forward and emphasize the scientific basis for a green and equitable economic recovery after COVID, and to hold government in doing this. Okay, so drawing from these examples, I want later in my presentation now to generalize a little bit about how we in the academies and others in the scientific community have learned to use the evidence in science policy dialogue. And obviously very much welcome discussion of these points during our Q&A. Much policy, of course, is developed at the national level through NDCs and national adaptation plans, other national plans, and indeed it's an important objective to integrate national level policy with local policy, for example, in cities or other local authorities. Science has a core role to play in all of these science policy interactions at the national and local level. And particularly, I think, we can see on climate change and health and the prioritization of mitigation and adaptation solutions that health professionals and the scientific community can take a leadership role in the broader climate change discussions. We need the evidence base and we need the health leadership. In addition to national level science policy, there are a number of regional connotations where impacts may cross national boundaries. For example, air pollution, infectious disease, migration, and regional activity must be considered in order to mount an effective response. It may not always be so obvious how the scientific community can engage with decision makers at a regional level. Yeah, in Europe, we have the benefit of regional policy-making institutions such as the European Commission and Parliament. But of course, other intergovernmental bodies, including a number of UN agencies, are an effective partner for regional science policy dialogue. And also, we should remember that there are inter-regional connotations. So coming back to the MENA region, there are important linkages between Arab states and the European Union and, of course, the rest of Africa. So there are inter-regional considerations here as well. And that leads me on to the global level as well. This exemplifies some of the practical engagements that the IAP project and its regional networks has been pursuing in Europe. And as I mentioned, the European report was published earlier than the other report. We've been active in engaging with the European institutions and national institutions and other intergovernmental bodies with responsibilities for Europe. Globally, there's listed here a range of UN bodies that we engage broadly, including the UN Food System Summit last year and the UN Framework for Climate Change. But there are others, G7 and G20, for example. But also, I want to use this slide to emphasize one other point, that the scientific community, if it wants to engage in science policy dialogue, must also engage with other stakeholders and the wider community, that is citizens and NGOs and other groups in the community, because these other groups obviously give important feedback and engagement to the scientific community, but also are very important routes to policy dialogue, to reaching politicians and informing change. This can be directly or through the media in various respects. I'm almost at the end of my presentation, and I'm sorry to have a late slide with such a crowded amount of information on it. I will try and summarize it very briefly, but hope perhaps we can pick up any points of detail in the Q&A. So really, I want to ask the question, what is distinctive about the Academy work I've described? Of course, there are other international bodies who have interest in very similar issues, that the Lancet Countdown, WHO, IPCC, who are publishing their sixth assessment reports this year. So what can academies add in terms of distinctiveness and value? Well, amongst the attributes of these projects, we emphasize our approaches inclusive and transdisciplinary, and it's based on excellent science. So we span the different scientific disciplines, and we're inclusive in terms of the evidence that we view. So, for example, in our forthcoming global report, there is a significant discussion on issues for Indigenous people, for the impacts of climate change on their health, for the role of Indigenous people in collecting information, and the role of Indigenous people in contributing to adaptation and mitigation solutions. So we try to be inclusive. We seek to capture diversity of evidence, and from that diversity of evidence to identify where there is consensus. These are consensus reports, but also to identify where there is still controversy and where that controversy can be addressed by new research. We involve younger researchers as well as the more experienced. This is important for a number of reasons. One reason, of course, that it helps to build the capacity for future work at science policy interfaces with the next generation. And in terms of the science policy interfaces, where we seek to offer advice to decision makers, we've learnt from experience that contact must be initiated early on and sustained. It's not enough just to come along with a particular report and expect it to have significant impact. Our influence must be based on sustained engagement over a number of years. In addition to our own Academy reports, we do work hard to try and publish in the peer-reviewed literature to reach a wider audience. And in some of that literature, we have gone into quite a lot of examination on what works in terms of informing the science policy dialogue. And I refer you to some of these publications that are all listed on our EASAC website. Finally, and this is my last slide, I come back to climate change and health at the science policy interface. What are we asking policymakers to do now? Well, first, to recognise that there is sufficient evidence to act now to proceed with solutions. And those solutions must be both addressing mitigation and adaptation. There are gaps to fill, but by new research in terms of quantifying the solutions, prioritising cost-effectiveness of solutions, identifying long-term scope for solutions, particularly in some of the lower and middle-income countries, because a lot of the current literature base is skewed geographically away from lower and middle-income countries. There's a need also to strengthen the monitoring to link the different variables in the databases for health, climate, socio-economic status, in order, again, to focus on those who are most vulnerable. So essentially, we're pursuing not just health, but health equity and climate justice. And as well as filling the evidence gaps, I want to reiterate the point that in the scientific community, we need to counter misinformation, whether that's at a policymaking level or in the media or wherever. And finally, we want policymakers to recognise that the academies, through their global and regional networks and at the national level, do stand ready as part of the scientific community to continue engaging in collecting evidence and participating in science policy dialogue. So, finish there. Thank you very much for your time. I know I've covered a lot of material, but I hope I've left a little bit of time for discussion. So thank you very much.
Absolutely. Thank you very much, Robin. You have indeed covered a lot of ground, an insightful presentation. Thank you very much. You illustrated very clearly the climate change impacts on health through various examples. You stressed on the importance of science policy interface. I think we have 15 minutes. I would ask attendees to share their questions. Already we have one question. I think it resonates. You were saying we need to fill some knowledge gaps. So there is a question to you saying, where should the academics and researchers put their efforts and plan ahead? What would you recommend?
Well, let me just return to a couple of points that I've already mentioned in terms of research. First, that there is a rapidly growing amount of research being published on climate change and health. When the Academy started their work several years ago, and in fact, it seemed to me to be quite unusual to see publications on health aspects of climate change. That has changed. It's a very rapidly accumulating evidence base. But as I mentioned, geographically, it's skewed so that there's relatively little research conducted in, with and designed with researchers in lower and middle income countries. And that clearly is a priority. The previous research is also somewhat skewed in terms of topic. So there's been relatively little on mental health issues, for example. And again, I think there's a big agenda there. A third point is that researchers, for very good reasons, have often focused on either the impacts that are currently observed or modelling future projections. I think there needs to be more research actually on observing the changes rather than modelling them, but also very much, as I said before, focusing on solutions, mitigation and adaptation, resilient health systems, to identify the determinants of those solutions, to prioritise those solutions in terms of cost benefit or whatever, to consider the long-term consequences of those solutions, whether the projected benefits were actually achieved. Now, there is a risk of, for example, maladaptation in some regards. Also, research is needed to explore synergies and trade-offs between different policy objectives. So there is a big research agenda there. It requires transdisciplinary research across, so I mentioned the medical, biological, physical sciences and the social sciences. So there's a great need to integrate research agendas and, of course, to include the users of research and the recipients, whether that's in terms of the community itself or to understand what policymakers want or what farmers want or whatever. And finally, I guess to emphasise the point that the health issues are not confined to the health sector. A lot of other sectors, mentioned water, agriculture, are very important in delivering health and health equity. So research for health must be incorporated in some of these, in all of these other sectors, as well as what might be conventionally considered as epidemiology or medical research.
Thank you, Robin. We have a second question in the chat. I don't know if you would want to answer it, but I will raise it. So good health lies in a good climate. So don't you think that climate change is caused by companies destroying the environment? And what do you think about that?
Well, it's it's a big area, and so yes, okay. Well, let's dissect it a little bit. Yes, good health lies in a good climate. I think we can all agree with that point. Climate change has been caused by all of us, particularly in developed countries, by our behaviour over past decades, whether that's in terms of overconsumption of goods and services, fossil fuel combustion, and other activities that have damaged the environment, absolutely. And fossil fuel combustion is a good example where coal, oil, other fossil fuels lead both to air pollution and the health consequences, and to greenhouse gases and climate change. And of course, may well damage the environment in other ways. Now, of course, individual companies and sectors have been involved in that activity. And as consumers, essentially, we've encouraged that activity. And of course, perhaps arguably until a few years ago, we didn't appreciate the consequences of those activities. But well, now we do. And now I think that there is great recognition that we need to phase out fossil fuels over the next few years, other polluting activities, and that includes, for example, some of the polluting activities of agriculture that contribute to climate change and to damaging the environment in other ways. So we're beginning to understand much better how we can reduce and reverse the impacts of those activities on the environment and on human health. So we now have no excuse not to act. And of course, as many of you will know, many companies have signed up to pledges to decarbonise their own activities, to act in other ways that won't destroy the environment. Of course, it's important for the scientific community and others to hold those companies to account, to ensure those pledges are taken forward and not just greenwashing, but they are genuine change in activities and in behaviour. So I think my short answer is we need to work together in partnership with the companies, whatever private thoughts about particularly egregious behaviour. We do need to work together and encourage mitigation and adaptation solutions, for example, by reducing subsidies to polluting activities. So that's obviously a task for governments and others to consider the fiscal environment in which companies operate. And I think, for example, if there is a reduction in subsidies for fossil fuels, then companies will be less inclined to promote fossil fuels and will want to change even more quickly to the use of renewable energy.
Well, related the question, but maybe at a higher level coming also in the chat, is what are the important and urgent steps to make the problem of climate change a top priority for countries and governments? And let me maybe add a little bit to that question from my side, because you asked for health leadership. And frankly, the ministries of health, just like ministries of environment, don't really have a place around the planning table in our countries. Perhaps things have changed a little bit with COVID because we felt the urgency of acting and we empowered ministries of health, but otherwise they don't. So how would you, is this linkage between the health and climate helps the climate issue?
Yeah, I mean, it's a very good question again. And you make an important point about the lessons from COVID. I think that the response to COVID taught many countries some significant lessons for policymaking. One is, of course, to include scientific evidence on a day-to-day basis in determining policy, which hadn't happened really in a lot of our countries. And secondly, the importance of health to national life and society. And you're quite right, and the questioner is quite right, that until recently, policymakers did not give a significant focus to the health issues in climate change deliberations. And that's still true to an extent. So, for example, at COP26 last year in Glasgow, on a day-to-day basis, there was a lot of discussion about health implications of the climate change problems and how to address those. But in the political discussions, there was very little. And in the final communique, the Glasgow Climate Pact, there was only one very brief, insignificant really mention of health. So I think absolutely we need to raise the visibility of health in climate change discussions. And in a sense, the health community can make a powerful case because health is important to everybody. So some of the problems, other problems associated with climate change, may seem rather long time in the future, sea level rise or whatever, but health is here and now, and the issues are immediate. So it does attract public attention. It can lead into wider public discussions about climate change. Health professionals tend to be respected and trusted by the public so have an important role in the community to advise on the problems of climate change and the solutions in terms of adapting sustainable, healthy lifestyles. And also, however, that there is a role, I think, for the health community to take on a bigger role in the broader climate change discussions. As you say, that there is a political challenge in many countries, that it's not necessarily the Department of Health that comes to the foreground in broader discussions about national priorities, including climate change. As you said, that may be beginning to change with COVID. So certainly, we in the Academies and others see it as a very important issue to highlight to policymakers. It's not just about the health sector, it's about all sectors and all the discussion on climate change.
All right. Well, we have 5 minutes and a final question, I think, and it's an important one, is how to use big data to preserve the environment, and what is the role of big data in that science policy interface?
Yeah, it is a good question, and there is an important increasing role for big data. I mentioned previously that the need, for example, to identify and integrate different data sets for health, environment, climate, socioeconomic status. Each of those data sets on their own may need research and surveillance, improvements to construct high quality accessible data sets, but we also now have to do more to join the data sets together in big data. And of course, that raises issues for their interoperability, the quality of the data, for who's going to curate and own those data, how accessible are they to those outside of the people who've constructed the data. And I think, again, that's an issue for a number of countries, particularly lower and middle income countries, that quite often data sets produced by external sources are expensive to access. So that is certainly an issue for big data. How do we access and use it more freely? There may, of course, be issues for some of the data on health, may be subject to privacy concerns and so on. So there are issues for ensuring security in sharing data. But there is absolutely, no doubt, an important increasing contribution to be made by big data. For example, in the agriculture and food systems area, with increasing use of robotics and precision agriculture, a lot of this relies on collecting very detailed data at the local level and at a global level through satellites, for example. There's a lot of different data sources that need to be integrated and used. So very important. And of course, to some extent, the availability, advances in other technologies, particularly mobile phone and media technology, provides a relatively cheap and easy way to share data, including quite large amounts of data. Much more needs to be done in terms of generating robust networks for mobile data. But we're beginning to have the instruments to share data, and of course also to collect data from, whether that's from citizen observations or social media or whatever. There are new sources of information that will enter the domains of big data to augment the data that's coming from other streams, from more conventional sources, UN agencies or national governments or whatever. And again, there may be issues for quality and robustness of data. And the other is using big data for artificial intelligence, but that would be another hour's discussion, I think. So
Indeed.
probably will stop there.
Indeed. And thank you very much, Robin, for this enlightening presentation. I wish we had more time. We have to wrap up, I'm afraid, but this is the final session, in fact, of the Knowledge Summit. So I hope the attendees liked it and engaged with it. And we encourage them to stay tuned for upcoming events and activities. And I want to thank Mohammed bin Rashid Al Maktoum Knowledge Foundation and UNDP for their efforts and for inviting ESCWA and Robin to this session. And have a great evening, everybody.
Thank you, Jana, and thank you to the audience.
Take care. Bye-bye.
Bye.